A major clinical trial on lower back pain was just published in The Lancet this week, so let's go ahead and break that down. The study wanted to observe the effects of something called cognitive functional therapy for patients with non-specific chronic and disabling lower back pain. Although it seems simple on its surface, chronic lower back pain is a major problem and there aren't any simple solutions. Many people have tried to find the answers for lower back pain, but clinical trial after clinical trial have shown that most people who get treated for lower back pain get moderate results that don't really last that long. If you've seen some of my previous videos, we know that pain is associated with biological, sociological, and psychological factors, and most healthcare practitioners really focus on the biology and mechanical aspects of pain, but this ignores the complexity of the human experience. We know that pain is associated with stress levels, we know that it's associated with mental health, we know that pain is associated with our beliefs, and this can be contaminated by the information that we have about pain and the interactions that we've had with different healthcare providers who associate pain with specific postures or different movements, and how you have to address mechanical causes even though you might not have a mechanical problem that's truly causing the pain itself. So this was a multi-site randomized clinical trial, so high-level evidence that compared cognitive functional therapy against usual care. What they found was that there was significant reductions in pain-related disability and improvement in activities, as well as just total pain that was pretty durable throughout the course of a year. So what is cognitive functional therapy? It addresses a lot of those mental, psychological, and social aspects that contribute to the pain experience. It helps people understand where pain is really coming from. It helps them go through movements and expose themselves to pain under control. It also introduces lifestyle changes that may be contributing to pain, including things that contribute to inflammation and stress. Here's what I like about cognitive functional therapy. They're looking at the totality of someone's health experience, including cognitive, emotional, and social factors, and it gives them a general idea of what may be a major contributor to someone's pain experience. So instead of just looking at it from a very basic level of saying, well, your glutes are weak, we need to really strengthen your glutes, they look at, say, what's someone's emotional experience and how is their emotionality contributing to their pain? What's someone's sensory sensitivity and what movements are they sensitive to and how might that contribute to their pain? And they design interventions to address those specific aspects of their life experience. Now, there were problems with the trial. The control group was fairly weak, the patients were left to their own devices, and they knew they weren't getting the special interventions, so the placebo effect is a little bit off the table. But ultimately, the trial shows that if you have a clinician that can break pain mythology, help the patient expose themselves towards movement again, and help them feel safe and confident about their status with lower back pain, a lot of patients can get better, and it saves people a lot of money to get this style of care.